what we'll be talking about is four main topics, which is really building your team and who should be a part of that team when it comes to special needs planning, developing a special needs plan, and how your unique situation could impact that. And we'll talk a bit about special needs trusts and how they can be a great tool for planning, as well as an overview on ABLE plans and how they work, and figure out if maybe that would be a good route to go down. And so as far as building your team, the three, I guess, components of your team would really be a financial professional like our team to help you plan for all the financial goals that you have for your loved one and for yourself. The second individual or team of people would be the government benefits specialist, and they can help you take advantage of the government benefits that you'd be eligible for and your loved one would be eligible for, and resolving care management issues. And then the third component would be a special needs attorney who has experience working with families like yourself. And if you don't already have a team like this, it's all right, but it's always important to put one together as soon as you can. And so whenever we start talking with a new family, the first thing we talk about is their team and if they're missing anybody. And really what we do is help them find people they need to fill in the gaps. And once the team is assembled, they all work together in one cohesive party to make sure that your bases are covered and make sure that you're planning for the best possible future for your loved one. As far as developing your special needs plan, once your team is assembled, that's where the development of the plan begins. And so the first step is to understand what your current situation is and what your goals are. And that's something where your financial professional can help you. And it's something that I spend a lot of time with my clients on, essentially because everyone's situation is so unique. And to make sure we choose solutions that make sense for you and your family, we need to have a full understanding of where you are today and where you want to go. And so really just thinking about the future and what do you want for your loved one? What does that look like in 5, 10, 20 years? And how do we develop that plan based on your goals and based on their goals? I can't see anybody right now just based on where my computer is. So is there anyone with questions so far? I know I'm kind of going through this quickly, but I want to make sure that we get everything we want to get accomplished in the next 15 minutes.
I think maybe if anyone has a question, put it in the chat so we can see it, or raise your hand.
Yes, and we can get to those at the end as well. Thank you, Chase.
There we go. So as far as the benefits that your loved one may be eligible for, there's supplemental Social Security or supplemental security income and retirement income benefits from Social Security, health care and custodial home care services from Medicaid, vocational services to help your loved one find employment, public school services like therapy, tutoring, and specialized support services. And your family member could even be eligible for financial assistance, medical coverage, and other services through the U.S. Department of Veterans Affairs. There are some of the more well-known benefits, but there are many others too, all offering different types of aid with varying eligibility requirements. And there's a lot of information out there to sort through. And in my experience, there are a lot of people leaving benefits on the table. And so that's where that government benefits specialist that I mentioned earlier really comes in, because their job is to make sure that you have access to all the financial aid and resources that are available and that you aren't leaving any money on the table. And so one of the biggest benefits and one of the most important ones would be Social Security. And so as far as eligibility for Social Security, if a child with special needs is under age 18, the parent's income, assets, and household size are used to determine the child's eligibility. Once that child turns 18, that changes. Since they'd be considered a legal adult, the federal government looks at their personal assets instead of their parents'. So if your loved one has less than $900 a month of income and assets, he or she could be eligible for benefits starting at age 18. So in 2019 is when the data was pulled here, that benefit amount could be up to $771 a month, so long as they're eligible. Once both parents retire and start taking Social Security, that child could also be eligible for Social Security benefits as long as he or she was considered disabled before age 22. The child's benefit could be up to 50% of the parent's benefit, and it also depends on the parent's work histories. What's great is that claiming the disabled child Social Security benefits does not affect the Social Security retirement benefits that the parents receive. The important thing to remember here is that all kinds of benefits your loved one might qualify for now, but if he or she doesn't qualify for them today, that could change in the future. So that's where the government benefit specialist can also help you stay on top of those things and take advantage of the new opportunities as those come up. Jason, I saw you asked about the government benefit specialist. Some of those do depend on state by state, but I can send Shannon some more detailed information on that after our meeting today, if that's all right. And then Shannon, could you get some of that information out to anybody who has questions?
Yeah, I'll be sending it out to the whole list along with the recording so they can watch this again.
Perfect. Awesome. Perfect. Jason, one great resource that I would mention would be the Special Needs Alliance. If you just search Special Needs Alliance, I think it's sna.org or specialneedsalliance.org. There's a lot of good information on that website as far as government benefit specialist goes. What if your retirement does not entitle you to Social Security, retired teacher, STRS instead? So Sue, it sounds like that'd be a state-specific question. I think maybe that'd be a question that's best answered offline as well, depending on the state specific and the specific situation, if that's all right. Okay. So as far as developing the special needs plan, it's really important to estimate the future potential costs that your loved one might have in the future. So of course, it's impossible to know every bit of the medical care or help that they'll need throughout their lives, but there are a few things you can estimate and take into consideration. For example, you're probably providing a lot of care for loved ones by yourself for free. Essentially, you don't charge your child every time you drive them to physical therapy appointments or doctor's office visits. But if your child outlives you, those services probably won't be free in the future. And so there's different ways to estimate those costs. Of course, it's not something anybody wants to think about, but ultimately, if you passed away first, who could possibly care for your loved one the way you do? And the answer is probably nobody. And so if you have a plan in place, you can rest easier at night knowing that should something happen to yourself before your child, that there is a plan in place for them. We also want to take into account where you live as well, because of those state-by-state benefits and state-by-state regulations that apply as well. Oh, I skipped ahead too far. Here we go. One more question in the chat. Let's see. Great question, Katie. So the 529 plans or college plans, essentially it all depends on how they were titled. It depends on the state specific, because each state has their own 529 plans. I think that when we get into ABLE plans here in a minute, that might also answer some questions you have around that, if that's all right. So as far as third-party special needs trusts, there we go. If you haven't heard of a special needs trust already, that's okay. So if you're not familiar with them, a special needs trust can be set up for your loved one to help provide funding options to supplement their government benefits. So those benefits, like we talked about earlier, Social Security, Medicaid, those cover bare necessities for your loved one, like food and a place to live. But a special needs trust is used to pay for things that the government benefits don't provide. They can help build a better life, things like rehabilitation, supplemental medical care, computers, entertainment, and travel. So those are things you probably want for your loved one to have access to, but the question becomes, why should you start a special needs trust to help cover them? And the reason why is because a lot of those government benefits are based on income and asset limits. And so if someone leaves money to your loved one, that money goes directly to them. And the government will consider that money as income or assets, and it could disqualify your loved one from getting some of the benefits that they're relying on. So even though the intention in giving money was probably to increase quality of life, it might end up doing the opposite if that money is left directly to the child. So if you have a special needs trust, those assets can be left to the trust. And because your loved one with special needs is no longer the direct recipient of that money, the money generally does not count as income or assets, which means their government benefits are not typically affected. So a special needs trust can go a long way in providing financial security for the loved one by having that separate entity. So when it comes to special needs trusts, the four big components are, having the attorney that's a part of your team. And so these trusts are very complex and they do vary based on the state. And so it's important to have an attorney who isn't just your generic attorney who does a lot of different things, but you want to make sure you have an attorney that's experienced in special needs planning, an estate planning attorney or elder law attorney to draft that trust. That attorney is also going to work with you to have to name the trustee. And you could have a family member serve as trustee. However, it's very common for a bank to fill that role instead of the individual. And it's something you should also consider. Banks typically have experience in this area, and it's their job to know exactly what can and can't be paid from the trust. And having a bank as a trustee helps prevent money from being withdrawn in ways that could disqualify your loved one from getting those benefits, as well as serving as having a component of longevity that outlives an individual, typically speaking. And when you're thinking about how you want to fund the special needs trust, you may want to consider using life insurance to fund it. If you're the parents of a child with special needs, the worst thing that could happen is that both parents pass away early and that child's not taken care of. But when your special needs trust is in place, you can have that insurance policy pay out to the trust either after the first or the second parent's death, and depending on what makes the most sense for your situation. So essentially, again, using that trust as an outside entity to still help your child, but not leaving the money directly to them. And finally, the trust that can be set up. So if your loved one with special needs passes away before the funds in the trust are used up, that money is not going to be lost. The remaining assets can pass to family members or secondary beneficiaries. Are there any questions on special needs trusts or anything I just went over there by anybody? How are we doing on time, Shannon? Are we okay for another 5 minutes? Okay.
Yeah.
Alrighty. And then the last thing I wanted to cover today was ABLE, or 529A plans. ABLE stands for Achieving a Better Life Experience. ABLE accounts are tax-free savings accounts for people who are diagnosed with a long-term disability before their 26th birthday. They can be set up at any time, and they can be very helpful in helping your child. And so while a lot of people with disabilities depend on public benefits for their basic needs like food, housing, or healthcare, those programs often have asset limits of $2,000. Essentially, if asset limits go above that $2,000, it can disqualify them from those public benefits. ABLE plans do not affect Medicaid eligibility, and as long as the account balance is under $100,000, it won't affect supplemental security income either. Contributions to the account are post-tax, so you're paying tax on the money today when you put it in. And some states do allow tax deductions on those contributions. However, they cannot be deducted from federal income tax. But when the money's inside of that ABLE account, the funds grow tax-free. And when used for qualified disability expenses, the money is also taken out of the account tax-free. And so those ABLE accounts, they can be used for a wide range of things such as education, housing, transportation, employment training, assistive technology, personal support, healthcare expenses, and just about anything else that could improve your loved one's health, independence, or quality of life. One thing to note, though, is that any money, if your loved one passes away with money still in that ABLE account, those funds may go back to the state to reimburse the state for Medicaid support, Medicaid costs that they incurred. And so to determine if an ABLE plan is right for you, consult with your financial professional, but also visit ablenrc.org to learn about your state-specific ABLE plan. So every state has different rules around that. So that's where that ablenrc.org is a very good resource to visit for some information there. And so I wanted to put together a side-by-side comparison of ABLE plans and third-party special needs trusts and see how they differ. So as far as eligibility, you can open an ABLE account anytime, but it can only be created for people whose disability happened before the age of 26. Special needs trusts do not have an age limit on when that disability was incurred. And as far as account setup, ABLE accounts are very easy to set up by anyone. You don't have to hire an attorney to help you, which means there are no attorney fees. Because a trust is much more complex, and estate planning or elder law attorney needs to set it up for you, and that means you have to pay for that service. For contribution limits, there's a $15,000 contribution limit in place for ABLE accounts each year, and that does index with inflation. For special needs trusts, there are no contribution limits. As far as account balance limits, if the child's receiving Social Security income benefits, the ABLE account balance cannot go over $100,000, or you risk losing those benefits. And there are no maximum balances for special needs trusts. For the uses, both of them can be used to pay for a wide range of needs, but there are more limitations on the trust. You cannot use a trust for things like food and shelter. For taxability, ABLE accounts provide tax-free distributions, but in some situations, the beneficiary may be taxed on distributions from the special needs trust. For the remaining assets, if the beneficiary, the person with special needs, passes away with money still in the ABLE account, that money may go back to Medicaid. For a third-party special needs trust, it gets passed on to other family members. And then ease of access is also very important. For ABLE accounts, some states allow checking accounts, debit cards, and they can give your loved one a greater sense of independence with more ease of access to that money. With special needs trusts, the money is a little bit harder to access because the beneficiary has to go through the trustee, whether that's a family member or a bank, and you have to request money from them directly, and there's no checking accounts or debit cards available. So it can be time consuming, but it does help ensure that the money is used for the right types of things. And of course, with planning for your loved one with special needs, it's always very important to plan for yourself as well, because ultimately, if your financial house is not in order, it can make it more difficult to help your loved one. So just make sure that when you're working with your financial professional, they need to help you identify your goals and set priorities, create and execute that customized plan, and make sure that plan's still aligned with your changing life. And that special needs planning for your loved one is part of your financial plan, not separate from your financial plan. And so just a few notes as far as the financial professional. Make sure you work with someone you trust, someone who's experienced in planning with special needs, because it is a very complex arena. Making sure your financial professional will work with you over time as your needs change. And then also selecting a company that has a very strong history and maintains the highest financial strength ratings in the industry. There's 4 major rating services: Moody's, A&M Best, Fitch, and the S&P. And those rating services tell consumers how strong that financial services company is. And ultimately, when the ratings are second to none, when they're AAA rated, that's a very strong company to work with. Give you a lot of can really put your mind at ease, when you lay your head on the pillow at night, knowing that you have a strong company backing you and your plan. And just a few notes also as far as the recap: assembling your team, developing a special needs plan, and then also planning for yourself.
All right, looks like we do have one question from Katie Dean. Katie, I don't think we can hear you, but if you want to unmute.
Yes, I had a question. So what can we set up that they can take the money out and use it how they like without losing the ability to have the services once they're past the age of 18, but also if something happens with regard to not surviving, all the money we put in isn't lost.
Mhm. Yeah, Katie, again, it depends on your state and some of the regulations there, but ultimately a special needs trust would be the one that would ensure that that money inside of that account or inside of that trust is not lost should they pass away before the money is used. But again, there's limitations on what that money can be used for, and so oftentimes a third-party special needs trust and ABLE accounts can work in concert very well to accomplish both of those goals.
And so if she has a 529B plan, a college fund, that money can't be used in this interchangeably with 529A?
No, the ABLE accounts are different because of the shelter they have around them from the loss of Medicaid and the loss of supplemental Social Security.
Okay, so the third party special needs trust, she can't go to the bank and take out $10,000 because she wants to pay her mortgage or whatever.
Yeah, you'd have to go through the trustee.
Trustee, correct.
Yeah.
Okay, thank you so much.
Yeah, good question.
We have a couple of additional questions, and I want to hold them until the end if we could for a moment. And apologies, we had a little technical glitch with Zoom at the beginning of this call, so we're actually kind of going a little bit in reverse order. I don't know if we actually had a chance to introduce Chase. And Chase, thank you very much for an extraordinarily beneficial presentation. But Chase is a financial advisor and director at Northwestern Mutual, and he partners with the Corneille Financial Group in Chicago to help families with individual special needs. So Chase has an awful lot of experience in this area, and we're very grateful to have you with us tonight. He'll be with us through this call, so if we do have some additional questions for Chase or for our second speaker, who was originally going to be our first speaker, let's hold them to the end, and then we'll get back to them. Our second speaker tonight is a lawyer originally from the Chicago area, now lives in Minnesota. His name is John Corneille. John is the director of legacy giving at the Foundation Fighting Blindness, where I worked for 10 years before I joined the Cure JM Foundation. Prior to his joining the Foundation Fighting Blindness, John was an attorney engaged in private practice in DeKalb, Illinois, and a significant part of his practice was devoted to estate planning and estate administration. So here to share with us some of his experiences in working with families like yours and ours, I'm happy to introduce John Corneille. John, over to you.
Mute, currently unmuted.
Can you hear me?
Yes.
Okay, good. Sorry, that probably was user error, not Zoom error at the beginning, so I apologize for that.
Your JM was left to me.
And we still there?
Yeah, we're here. I think that was your jaws a little bit, John.
Yeah, it's so forgive me, folks. I am visually impaired. I use screen reading software, and it tries to jump in whenever something comes on the screen. So I'll continue to try to kill that. So I apologize for the annoyance that may bring. So my plan was to really just talk in general terms about the importance of doing something and what can happen if you don't do anything. And now I got the opportunity to listen to Chase's presentation. I just wanted to maybe follow up and piggyback on a couple of things that he said that are really important. So I was an attorney in a private practice of law for over 30 years, and I lived in a community of, say, 30 to 40,000, and I had a general office practice. And while I did a lot of estate planning and estate administration, and I was appointed by the governor of our state as the public guardian for our state, I did a lot of adult guardianships. I probably only worked with one or two special needs trusts during my 30-year career. So if somebody would have come to me, in spite of all the general experience that I would have had, I would have reached out to somebody else and referred them to somebody that does this kind of as a living, because it is a complex area. It's really important that the trust be drafted properly that it only be used for the types of benefits, not like Katie mentioned there, a mortgage payment or something like that. But it has to be drafted really specifically so as to not run the risk of denying eligibility for government benefits that might be there. So you can go to usually finding an attorney, I think like a doctor, word of mouth, somebody you trust. I actually forwarded to Jim a while ago an attorney in Virginia who concentrates her practice in special needs area and this type of thing that we're talking about this evening. And a lot of that can be done where you don't have to go and actually meet. It can be done over the phone. So my point is that she might be able to work with people that are not necessarily in the state of Virginia. You can also go to the web and find there's an American Academy of Estate Planning Council, which is kind of a high level elite organization of attorneys who focus their practice on estate planning and disability type practices. So the American Academy of Estate Planning Council is another thing you can look at online. And the last thing is, believe it or not, I really think Social Security has a pretty good website. I don't always say that about government websites and everything, but they've done a lot of improvement to it. And I would definitely go there and search around and find out some information. If nothing else, it gives you the ability to better know what questions to ask. So what I want to talk about now is depending upon what article you read or what research you see, either side of 50% of the people in this country die without a will, which probably means no estate plan of any kind. And there's a variety of reasons for that, but I tell you, in my personal and professional experience, I just think it's a lot of it is people just don't like to talk about death and dying, end of life issues. When you're young, I think there's probably some young parents on the phone here tonight. Maybe there's some grandparents. When you're young, we all think we're invincible. Nothing's ever going to happen to us, et cetera, et cetera. But we all know when we think about it, that's not true. We never know when our last day is going to be. So if nothing else, I hope that tonight motivates you to do something. Engage in a plan of action. And it's not going to happen overnight. It's going to take some time to think about it. Each circumstance is different. I don't know a lot about the disease you fund research for, but what I think I understand is that it really affects children in different ways. There may be some kids who are disabled and may not have the ability to have gainful employment their entire adult life, but maybe others who will, and maybe have the ability to have pretty significant and meaningful earning capacity during their lifetime, or maybe a diminished earning capacity. So all those things make a difference as to your estate planning when you're planning for those kids, as to whether or not a special needs trust makes sense, or maybe a different type of trust. So one of the biggest things I ran into with young couples who, when I talk about estate planning and I do a presentation, said, well, they would say something like, well, I don't have any money. I don't really have an estate. I don't really need a will, do I? Well, and that may be true as far as their financial analysis, but if you have children, you need a will, because while it is state specific, like many of the things that Chase talked about, generally speaking, you are considered the legal guardian of your child until age 18. And typically you don't need to go to court to get yourself appointed as an official legal guardian. You usually can get most things done. But if both you and both parents die and you have a child or children under age 18, and you have not provided in a will for who's going to be the guardian or where those kids are going to live, then it's left totally to state law as to who is going to raise your kids. And it varies, but generally it's about the same. Usually they defer to family members, close family members, grandparents, siblings, that type of thing. But it may not be the person that you want to raise your kids. Anybody would have a right to petition the court to be appointed as the guardian. So the one thing that happens is you lose total control. So even if you have, like a lot of young people, you're still building your net worth and you don't really have a lot of assets, you do need to put something in place for guardianship for your kids. So there's a guardianship as far as who's going to raise the kids, where are they going to live, who's going to have physical custody. But then there's also the concept of, well, what about money? What about money that you do have? Or what about money that maybe a grandparent would supply to add to a nest egg to help take care of children? You might think that you don't have anything, but if you really sit down and think about it, most people, if they're not self-employed, they have a 401k plan. That can add up pretty quickly. You have money in the bank. You might have cars that are paid for. You have a house that maybe has some equity in it. All of those things turn into real money that you're not going to want a 7 or 8-year-old child to be able to handle. So you'll need to set up within a will a certain type of trust. And it can be a special needs trust, if that's the right thing, or a different type of trust where the trustee that you name, the manager of the money, so to speak, takes that money, invests the money, pays it out to the child or children as they need it. And they can deplete the entire amount of that money if they want to. It's not like a special needs trust. A trust like that can be used for any purpose that the terms of the trust would dictate. So if it was education, if it was to buy a home, if they needed a car to get back and forth to work while they're in college or something, or for college expenses, a trust that's not a special needs type trust, if it makes sense for your family, can definitely provide for those things. And you can delay for a long, long time when your child would get the principal amount of that trust or the bulk of it, say it another way. So you could delay it until age 21, age 25. I've seen even age 40 or 50. So the trustee can continue to manage that money and dole it out over time, depending upon what you as a parent decide in your will. So these are different types of trusts that become effective upon death, which is when your will becomes effective. So just like I said, that if you die without a will and direct who you want to be the guardian of your minor children, if you die without a will, the state where you live at the time of your death will also control what happens to your money. It's called dying intestate, or without a will of any kind. And again, each state is a little bit different potentially, but generally, like in Illinois where I practiced, if a person died without a will and had a spouse, half would go to the spouse and half would go to the children. Now, that's not what a lot of young people would want to have happen. Typically, they would want everything to go to the spouse. But if there's no spouse, everything goes to the children. If there's no spouse and no children, then it goes down to the next level. It gets split amongst grandparents if they're surviving, siblings if they're surviving. So the bottom line is, again, you have no control over it. A will is what will give you that control of whatever you have. And then just by chance, is what I do at the foundation where I work, is I work with people that might want to leave a gift to the foundation to help further the research. If that's something you wanted to do for Cure JM, there's no state provision that would allow a gift to any type of charity absent a will or a trust or some beneficiary designated account. So it's kind of the last thing that people want to think about and talk about. Oftentimes it takes a life-altering or startling event like a death in the family or a divorce or something like that. And unfortunately, sometimes where there's bad things that happen in an estate of a loved one, where I had people come in and say, gosh, my uncle just died and the estate was a mess, I got to do something. So put it on your list, start the research. If you don't have a lawyer, talk to people that you know. Just a lot of lawyers can prepare a pretty simple estate plan, but there are a lot of lawyers that really concentrate their practices in that area. So I'm using another computer here, so I'm listening in my earphone to my outlines. So just bear with me for 1 second. So even grandparents. So if you're thinking about taking care of your grandchildren, you can set up trusts within that as well. But again, make sure that you factor in any special needs, governmental benefits that they're receiving or might receive in the future. And nobody has a crystal ball. So all you can do is just use your best judgment based upon you and your family and your children's special needs in each circumstance. And don't forget that when you talk about an estate plan, you have to take into consideration everything that you have. And I mentioned before, what's becoming more and more popular are what we call beneficiary designated accounts. So if you think about your 401k plan, you know that you can designate a beneficiary on that account, a life insurance policy, a 403b plan, lots of investment or brokerage accounts, you can name beneficiaries, even bank accounts, you can have a pay on death clause. And keep in mind that those designations take priority over what you have in a will. So let's use a crazy example here. Let's just say that you have a 401k plan and you leave, let's say you name the beneficiary as your sister. But your will says that everything when you die goes to your spouse, or if your spouse predeceased, to your kids. Well, that 401k plan is going to go to your sister. So it's a contract between the account holder and you that says upon your death, we will pay the money to whoever you designated as beneficiary. And it takes priority over the will. That's very important to remember. So you need to be consistent and plan. So you might want to have a beneficiary designation to go to a trust that you create in your will. And that's where an experienced estate planning attorney will help you do all that. And then what happens when your child becomes an adult? In most states, I don't know of any state where it's not age 18. You no longer, even though you're the parent, you're not able to make decisions. You're not able to have access to bank accounts, medical records, anything like that. You typically have to go to court and have yourself appointed as the legal guardian for your child. And in most states, there's two levels of guardianship. One is the actual making day-to-day physical decisions and health decisions, and another level of guardianship would be the financial decisions. And there's many situations that that I handled over the years where maybe the person, they were fine physically, but they just did not have the ability to manage the money that they had. So they only needed a guardianship established to take care of their money and not their physical needs. So every situation is different. Every state law is different. But just keep that in mind, that when your child becomes an adult, your role and ability to participate and help is going to change legally. And getting your house in order, powers of attorney or advanced directives is another thing that you ought to keep in mind. And you can research all these things online. I'm not a big fan of online wills like LegalZoom, and it's probably because I'm old school. But you can definitely go to those sites to learn. Because a power of attorney, unlike a will, is something that takes effect during your lifetime. A will only becomes effective upon your death. So you can have a medical power of attorney where you, while you're competent, you fill out this form that states that if you become unable to make medical decisions for yourself, then the person that you name in that power of attorney or advanced directive is authorized to make decisions for you. Same thing with financial matters. You can have a power of attorney that covers financial issues. And that's really something that's important. A lot of lawyers do these things for not as much money as you would think, particularly in the estate planning arena. Now, some of the more complex things we're talking about, it gets a little pricey, but a simple will, a lot of lawyers do not charge very much money for that. So investigate, talk to friends, get word of mouth, like I said, is a great source for referrals. And then probably the last thing I want to mention is how often should you review these plans? Once you have a will in place, or you set up a trust, or these other powers of attorney even, how often should you look at those? You're going to hear different things depending on who you talk to, but certainly if you have any major life event, a divorce, a death in the family, a remarriage, something like that, you definitely ought to look at what you have. It doesn't necessarily mean anything needs to be changed. Major change in the tax laws, which there have been several of those that have happened during my career, which have significantly changed estate planning for avoidance or minimizing federal estate tax purposes. So definitely you ought to look at it at that point. And even powers of attorney, a lot of times the state legislature will have created by law recommended but not required forms to use. And these things change, like as HIPAA laws change. There was nothing about HIPAA back in the 80s when I started practicing. So now these healthcare powers of attorney have language about HIPAA laws and all kinds of other things, email and virtual meetings and all kinds of things that never were in existence before. So periodically you should look at those. And I always think that generally speaking, it's best to use the forms that the medical providers and the banks and the financial institutions are used to seeing. Like I said, there are all kinds of forms. They don't have to follow a required format, but the last thing you want is, particularly in an emergency medical situation, is to present a medical power of attorney that was drafted that nobody's ever seen before. Then they're going to have to look at it, maybe get their lawyers involved with it. So that's about all I have to say. I know the time goes much faster, so I'm going to stop right there. And if there's questions, Jim, back to you.
We do have a few, and thank you so much, John. And for those of you looking at the screen and wondering why my name is in John's box, it's because that was one of our technical issues, and I think John had to log in through my login to get on. So there's two of me. I guess that's not such a good thing. So anyway, we do have a couple of questions. First, I wanted to ask Jason. John referred to grandparents in some cases contributing to or setting up a trust. I'm not sure if he answered your question, Jason, but if you'd like to restate it, I'm sure both John and Chase could take a pass at that.
Yeah, I guess I was just wondering in the terms of if they plan on leaving things to RJM kids, should they set up a trust themselves, or would they just simply, if we set the trust up, would they simply just direct that inheritance money to the trust as opposed to having to set up their own trust for our kids?
Space mute. Currently unmute.
I'm not sure I understand the question. I'm sorry.
So mentioning setting up a special needs trust, if so, my mother, for example, is the grandmother to my son Logan. If she were to pass away and to leave money to him, it could impact his ability to then to collect on some of the other benefits, Social Security and things of that nature.
Right.
If I didn't already have a trust set up for him for that money to be directed into, and even if I did, would she need to set up her own, or would she simply just leave that money to the trust I had already set up? Did that clear it up for you at all, John?
Yeah, that's a great question. And my understanding to that is, yes, she could leave money to an already created special needs trust. That's definitely a question that you would want to confirm with her lawyer. You know, there may be differences if she's in one state and your child is in another state.
Yep.
That's a great question. Yeah, but I think that's doable.
Yeah, I would echo what John said. State definitely matters. The state in which the trust is drafted definitely matters. State inheritance tax laws also matter, because sometimes when grandparents leave money to a grandchild in certain states can impact the inheritance tax on that state. But also the type of assets that go into that special needs trust can have a neutral or an adverse tax situation that's put upon the beneficiary of that trust. So it depends if there's pre-tax 401k money or 403b or IRA money, or income tax-free life insurance, or post-tax Roth. It just depends on the type of assets also. So just look into that. Again, definitely consult with your mother's estate planning attorney and also yours on that specific question.
And a question from Karen Berman. Is the $15,000 limit for the ABLE plan in addition to the $15,000 annual gift limit that I think in one individual can give to another?
Good question, Karen. Consult with your CPA on your specific situation. However, in general, an ABLE contribution is considered a gift. And so right now, I think it's $15,000 per spouse. So $30,000 a year you can gift without filing a gift tax return. But as of right now, there's a $26 million exclusion for estate and gift tax. So again, it depends on your situation, whether that would be a negative thing or not. So just consult with your CPA on that as well.
Space mute. Currently.
Yeah, and I can add a little bit more to that. So yeah, the $15,000 gift is it's an amount that you can give to each recipient. So basically an unlimited number of $15,000 gifts can be made each year. And some people, when they're trying to get rid of money to avoid federal state tax, they'll give a $15,000 gift on December 31st and then make another one on January 1st in the next year. They have $30,000 in a matter of 2 days. But what Chase said is, even if you give a $16,000 gift, all that means is that you're technically supposed to file a gift tax return with the IRS. There would actually be no tax owed either by you as the giver or by the recipient. And beyond that, it gets pretty complicated. It takes $1,000 away from the amount you can die with and not have federal or state gift tax. So again, talk to your accountant about that, but generally you can give that without any issues at all, that 15,000.
Thank you, John. From Katie Dean, if we use a traditional trust rather than a special needs trust so the funds can be used more flexibly, would that affect their ability to get government assistance? Chase, over to you on that one first.
Yeah, that's a good question. And John, you can feel free to jump in as well. When it comes to traditional trust relative to third-party special needs trust, in those two categories, there is a multitude of different trusts beyond those. And in general, when you have money that's given or money that's put into a traditional trust, so to speak, those are not set up with the language that would shield your loved one from the adverse effects of losing government benefits. So in general, having a specific third-party special needs trust is the way to go versus the traditional trust route, so to speak. But again, consult with your attorney depending on your state, because there are pros and cons to both. And again, depending on your situation, it may make sense to have one or the other or both.
I totally agree with that. The answer is yes. If a traditional trust is worded differently, it's recognized by the IRS differently than a special needs trust. And that's where it gets down to, if you have the ability to predict or at least have some reasonable insight into your child's future, whether they'll qualify or need government benefits, that plays a large part in decision making on what kind of a trust that you go with.
Yeah, and if I could just jump in as a parent that honestly 4 months ago didn't understand any of this, I would just recommend, if anyone hasn't gotten started, or even if you have gotten started and now maybe a new diagnosis or something has changed, we set up a series of, after we built our team, we set up a series of every other week meetings with the attorney. It was all for a flat fee. And we went through checklists of questions, what did we expect for the child and the sibling over time? What were our goals? And he basically got to know us and helped us craft this and answer all these questions, so Jason could ask about his mom, and, Katie could ask about different trusts. And it was a painful 3 months of, meetings, but it was all done on Zoom. And in Washington, you can even have things notarized now during COVID online. So everything was notarized online. We never had to leave the house. And the attorney walked us through every single question we had that you guys are asking, and was really quite helpful. So if anyone is finding this as overwhelming as I did, starting the process with your team, the right estate planning attorney can really help walk you through all these kinds of questions and help kind of customize it for you and give it to you in bite-sized pieces so that you can digest it all and make decisions. So if anyone needs any help from just a parent perspective, let me know.
That's great advice. It really is. And I think you've hit on why one of the reasons that it doesn't happen right away is because it can be painful, in quotes, obviously not physically painful, but just kind of mind numbing at times to understand these things. And I will say that during COVID, there is more estate planning, more will preparation, more Google hits on estate planning and the things we're talking about than ever in the history of Google. So it's actually a good time with people being home. You got attorneys that are working remotely. Courthouses aren't as active as they've been. So there's a lot of the stars are aligned in this horrible situation that we're in to really make it a good time to start acting on these things.
And having a meeting set, for 3 weeks from today to get started is all you need to do to get started, and then you go to the next meeting and the next meeting, and eventually, a few months from now, you could be done.
That's right.
I have one final question. We've got a couple of minutes left for Chase. Jason, in our organization, we have, any number of, I mean, thousands of families around the country, and many who will be watching this presentation later on our website and when we send it out. But these families and parents are, pretty typically in their mid to late 20s, 30s, some in their, perhaps in their early 40s. What advice would you have for them around how to best meet their insurance needs, and how insurance might play into their financial planning for perhaps a special needs child?
That's a good question, Jim. Well, I think ultimately just, one thing nobody ever wants to think about is if they did pass away before their child, especially prematurely before your child's, able to take care of themselves. So I think, one thing that people may not realize is that if you just have your life insurance through work, that you could lose that life insurance if you left your job or if your job left you. And if you don't have life insurance outside of work, it can make it very difficult to get it later if you have a health issue or health condition. So, the price of life insurance and someone's ability to get it is always based on your health and your age. And so there's no better time than today to do that. Again, to just ensure your child's financial security in the future. The other thing is, again, depending on your situation, when it comes to special needs planning, joint life insurance can make a lot of sense. That joint life insurance is when the insurance policy pays out on the second death. So typically spouses are insured together, spouse one passes away, and then the payout happens on spouse two's death. And that can be such a useful tool in special needs planning because joint life insurance is actually the cheapest way, mortality cost wise, to own insurance. And that can be used very oftentimes to fund a special needs trust, especially with the fantastic tax benefits that life insurance death benefit has relative to other investment accounts or other assets you might leave. So is that what you wanted me to cover, Jim? Or is
it is. Thank you, Chase. Very helpful. And we have one additional quick question from Breezy.
Hi, I have a question. Is there requirements for the special need trust, or is everybody with Cure JM considered special needs?
Good question. In general, and John, maybe you can piggyback on this as well. In general, the purpose of the special needs trust is to shield those assets from the government benefits or the loss of government benefits for your loved one. And so essentially, if your loved one would qualify for those benefits, that's where the special needs trust comes in play, because ultimately disabilities and special needs, obviously it's a super wide array of different conditions and diagnoses. And again, depending on severity, depending on what you see for your child or for your loved one in the future, can inform the type of third-party special needs trust you employ.
Space mute currently.
Yeah, and I think what you're asking there is really a definition of disability. And from my understanding that of, again, limited, that not every child with JM is automatically going to be considered disabled from a Social Security standpoint. Would you agree, Jim, with that?
Yeah, I think I think so. It would certainly have to do with the the persistence and intensity of any individual child's condition, and and how that condition maintains into adulthood.
Right. Yeah. So, I mean, even even people that are blind are not automatically eligible for Social Security disability. You have to have the right doctors saying that, you know, I think, and I'm not sure if this is true for SSI. A lot of people are on SSDI, but if you're not able to engage in substantial gainful employment, I think are the buzzwords that Social Security uses. And they define that by your ability to earn a certain amount of money on a monthly basis. And that's just the tip of the iceberg. There's a lot of gray area. But yes, I mean, your child would have to qualify for disability under either a government program or some other type of disability payment program for special needs trust to be relevant.
And Breezy, I believe, I'm not sure if Sue or anyone else wants to jump in, but typically your hospital's social worker or Office of Financial Aid can direct you in the right spot to have one of the, you know, in our case, a social worker at the hospital can help guide you through how things work for your state and what forms a doctor may or may not want to fill out for your child.
Awesome. Thank you guys so much.
Well, John, Chase, we can't thank you enough for your time and for sharing your expertise. This has been extremely useful. I'm sure that we'll want to have you back for an encore presentation, maybe sometime later this year or early next. So with that, if anyone has any additional follow-up questions, please feel free to get them to Shannon or to me, and we'll make sure that we get them to John and Chase and can get some answers back to you.
And then Shannon's going to email everything to us, correct? The slides and everything.
I'll do that tomorrow. Yep.
Yep.
Okay,
Yep. And we'll
perfect.
include
Thanks,
the we'll
Shannon.
include the name of the attorney in Virginia that John mentioned.
Jim, thank you very much for inviting us. And JM, your gain was our loss at FFB. So we miss Jim, but you're lucky to have him. So wish you guys the best.
All right. Well, thank you all.
Right.
For having us.
Thank you. Thank you, John.
Thank you guys.
Folder 4.